This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
So I wanted to talk about a recent change we made in the department, which was our swap from our temporal thermometers to oral thermometers. And anytime we make like a department-wide change, I just want it to be evidence-based. So I wanted to kind of go through the evidence of that because I think it's actually pretty interesting. So they did a study on this not that long ago that they published in this Journal of Pediatrics just in April of 2025. They looked at 1,400 kiddos and they found that 26% of them had a statistically different temperature when they took an oral versus a temporal thermometer. And the temporal was always lower. And then of that, children less than 12 were 2 to 3 times higher chance of actually having that statistical difference. So the younger you are, the more likely you are to have a difference in that. But they also looked at adults. So they looked at 1,000 adults and they found that 36% of those had a temporal artery that was 0.5 degrees Celsius lower than the oral temperature or rectal temperature. And I think that last point is really important. So 1,000 patients, 360 of them have a temperature that's statistically different when we get a temporal versus an oral. And so why is that? You know, a thermometer is a thermometer. Why do we see a difference? I think there's two main real big differences. The first is environmental and physiological. So the temporal ones, they're affected by the ambient room temperature, by sweat, by diaphoresis, whether or not you actually get the temporal artery and the carotid artery, or you're a little bit off from that. And then also inconsistent readings. So let's say you have a septic person who's not perfusing well, or they're vasoconstricted, you're not going to get an accurate reading with the temporal thermometers. And then why does this matter? So in the age of sepsis, where we're all kind of focused on these, we're going off our 4 SIRS criteria. So temperature, heart rate, respiratory rate, and white blood cell count. So that's one of our 4 that we're deciding whether or not to pull the trigger on sepsis. And if we have an inaccurately low reading and we don't pull the trigger, for one, that delays our numbers. And number 2, from an actual patient perspective, sepsis does kill and we want to get antibiotics early and we want to get the right patient. So that's pretty much it. Just wanted to give you the real evidence behind it that thermometers, the temporal thermometers, although easier, I get it. The oral ones are more cumbersome, but they are so much more accurate. And we can do it right the first time and not have to backtrack 30 minutes later when we get our white blood cell count or lactate back and then pull our trigger for sepsis.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.